Imagine walking into a doctor's office or clinic and being told that your chronic pain is all in your head, or having a life-saving symptom overlooked because the textbooks don't depict it on darker skin. Well, for many, that's not imagination. It's the reality of a healthcare system that was not set up for everyone.
Absolutely.
So, Melamed, DEI is not just a catchphrase, right?
It really has meaning.
It can be the matter of life and death for many, right?
We have to just kind of move away from this term. Why is there a term that describes it? We know what's happening, and we just have to be ready to act on that and take care of ourselves and make sure that we don't allow anyone to stop us from getting the kind of care that we need.
Correct. For many people who go into medicine, or for those who interact with the healthcare system, they think it's a meritocratic or a science-based system. But what happens when the science itself is biased, right?
Absolutely.
When the research totally overlooks a particular demographic, then what?
Right. And those are important factors because we have to make sure that we're a part of the clinical studies. We have to make sure that we're right there at the table when decisions are being made. But that's everybody. Everybody should have that opportunity. No one should be looking at one demographic to make decisions on other demographics. Everybody needs to be there.
Unfortunately, there can be a particular sector that will bring a negative connotation to a issue that, like, they're changing the whole ramification and the voice of the message. And like you said, equity, that's important for everyone.
That's right.
When you have these sort of things in place, we all will have a positive experience with the healthcare system. And to take it away is a detriment.
Absolutely. Now, we just left October,
Right.
Breast Cancer Month.
Right.
And we know that Black women tend to have a breast cancer that is more aggressive. It kills them more often, even though we may be diagnosed less often. And again, that's a space where we find that we have to be more on top of what's happening to our bodies.
Right.
We have to make sure that we're getting those mammograms. And we have to make sure that we're getting a good reading of those mammograms. And so we're all have to look at where we fit in the frame of things and know that oftentimes what happens to us as Black women, what happens to our Black men is different than other demographics. Our men experience prostate cancer more
Right.
often. We all experience colon cancer more often. Our women experience breast cancer more often. And so that's not a DEI problem. That is a problem that requires us to have more attention to how medications work for us or what kind of screenings we need and when. And that should be okay.
Right. So let's take the infant mortality rate, for example. The infant mortality rate for African American born children is extremely high, much higher than that of Caucasian infants. It's also high for the indigenous and Alaskan babies. However, one of the things I found interesting is that the infant mortality rate for Hispanics is not as high. And so one of those factors has a lot to do with the way the moms are engaging with the healthcare system. And so often the statistics show that African American moms tend to receive late prenatal care more often than Hispanic moms.
Well, that's why it's good for us to even talk about the other side of that is who's taking care of our citizens, right? So it is important to have folks who look like you a part of the work, a part of taking care of you, because we may have a different focus.
Right.
We may understand the social context of our folks a little bit more.
Right.
And so it's important for those of you who are thinking about medicine, those young folks who are thinking about that, to know that we still need you
Right.
in the medical field.
So that is another factor of diversity. So before we were speaking about the diversity of science and research, but now we need the diversity of the workforce.
Absolutely, absolutely. So we can't get away from that.
No.
We can't let this degradation of, quote, DEI make us believe that certain factors about us aren't important.
Right.
That we don't need those folks, that we're not good enough. We've always been good enough. We just haven't had the opportunities all the time.
Well, one of the things that's happening is that a lot of the research that's being submitted for grants and that sort of thing, they're just scanning for the word diversity and inclusivity and equity. Those are like bad words now. So there are research projects, for example, that I'm aware of that have been denied funding because they saw the word diversity, but it was in reference to diversity of cells.
Wow.
Right. So it's really a very, very negative impact on healthcare not to be inclusive.
I tell you, I mean, just the idea that some words can do that. And we really need to think about that as a community of how do we get past this, or how do we make sure that we're not acquiescing to those who think that those words mean something bad.
So when you say community, you mean community at large, or the
community at
healthcare
large.
community?
And the healthcare community.
Right. One of the things the healthcare community has to do is acknowledge that it's necessary and just stand up for doing the right thing.
Right.
So prior to the whole phrase of DEI, the work was being done.
Absolutely.
And it remains necessary. So the work will continue to be done. We just have to make sure we don't have that umbrella of DEI.
And I don't want our new babies who are thinking about coming into medicine to think that you're less than. You are not less than. You are needed, and there are medical schools who are quite receptive to you being there.
Right.
We have to look for those special programs, like I just saw where Morgan State received like a $1.65 million grant to support minorities in medicine. TSU has a great program. And Meharry have a great program that caters to making sure that we're bringing in more minorities into the field.
The healthcare, right.
And that's important. It's not a gift. It's not a giveaway. It's
No,
ensuring
guess
that
what?
we all have it.
Those who want to rephrase and redefine what's going on with DEI would have you think that there are some extra things that are happening for minority applicants. But no, you still have to take the MCAT. You still have to score high. You still have to have the GEA to get GPA to get in.
Right.
And so no one is giving you anything.
And we all have to pass the same test to get out of medical school
and get your
to
license,
get into residency, to get your license. So there's no difference in that.
No, not
but
at
sometimes being in certain settings helps to lovingly guide us through, help us to recognize that there is a population who desperately needs us and has different symptomatology that will alert us to disease processes in us that you may not see in another population, and it's important to identify that.
Right.
And that's the way we do it. You have schools that are very interested in helping a particular population survive, and that's okay. I think we need to remember what diversity, inclusion, and equity really mean, and not allow folks to demonize what is just the truth.
That's right.
Just
acknowledging the differences and being impartial in regard to the care that we deliver.
Absolutely.
To everyone in an equitable way.